Hey, good morning, and welcome to the Uropatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our Uropatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So this week, we're going to finish off our Prostate Cancer Awareness Month, end of the month, last day. So we're going to kind of knock it off with what I told you about last time. Get tested. We're going to take it off of that stream of get tested. And I'm going to show you why PSA now is definitely more able to be fine-tuned as to your risk, and really something that even you can do. It's called the Prostate Cancer Risk Calculator. I'll go ahead and put that website on the line on the notes for you. But let's go ahead and bring that in here right now. I'm going to bring that in. So the Prostate Cancer Prevention Risk Trial Calculator version 2. And again, like I said, I'll leave you the website, but we're going to go and run that right now for you so you can kind of see what that looks like. So I think I'm going to make this full screen here. Let's see here. So you can see everything. You don't need to see me. So what it does is it looks at some characteristics that can increase your risk. So let's start out with kind of a Caucasian. So there's a different risk. You put in your age. So we're going to just say somebody is 65. And now we're going to put in the PSA, and that's that reading. And you can do this yourself, get the readings from your doc. So your plain old PSA, let's say it's a slightly elevated PSA. Let's say it's 4.5. So just right on that borderline. Now, was there a history of prostate cancer? Let's say no for this. Digital rectal exam, either they didn't have it done or maybe it was normal. So let's just say they didn't have one done. Prior biopsy, never had a prior biopsy. Now, here's something that it looks at also is something called free PSA. If you watch that PSA episode I told you about, it'll talk a little bit about what free PSA actually is, but it's a percentage. And when that percentage is high enough, it can make a big difference. So I happen to know 25% is a good number. So we're going to use that and then calculate the risk. And so now we get this smiley face thing here that you can see. So what's this show us what this exactly means? So this person, this fictitious patient, has about a 4% risk of having high-grade prostate cancer. Of course, that's the one you don't want to miss. There's about a 13% that there may be cancer there, but it's low grade, probably low risk of ever, going on and being something worse. And then 83% pretty happy about that it's negative for cancer. So again, good discussion. Would this be somebody that could be watched, or would it be someone you biopsy? Now, this is kind of interesting. This thermometer here, a biopsy is not without its risk for complications. And about 2 to 4% of men undergoing biopsy can have an infection that may require hospitalization. So that's kind of what it shows here. These poor guys weren't as happy they had it done, especially the ones down here who didn't necessarily have to have it done. Now, let's go ahead and show how that changes if we go ahead and change the algorithm. So let's say instead of being a white person, now you're African American. We'll leave everything else the same. Let's calculate the risk. So we know it just changed, right? The risk for high-grade prostate cancer is much higher. Now it's up to 10%, 14% for low-grade cancer, 76% chance it'll be okay. Now let's change one other thing. Let's change this family history. Yes, this person does have a family history of prostate cancer. Well, that risk just went up quite a bit. And those are with PSAs that are just barely elevated, and this percent free is in the normal range. Let's put this percent free in an abnormal range. Let's put this at 20. Let's just drop it a little bit. And we're going to calculate our risk. Look at that. So we see the risk is going up. Now, what if somebody had a really elevated PSA, like a 20. I'm not even go that high. Let's say 10. I always say 10 and above is the higher risk. Let's see what happens when we do that. Now 21% chance of high grade prostate cancer. This is the stuff that can kill you. 16% additional chance. So we're up to, these are added, by the way, of your chance for prostate cancer. So we can see it's starting to look not so good. Maybe I'll explain a little bit about how this gets affected. So again, race, if we change our race, it does change our risk. Just by the fact you're African American. If you're Hispanic, oops. Pretty similar to the Caucasian risk. Stick to the same. Now let's say that PSA really shot up here. I'm going to actually take the percent free out because sometimes you don't always see that. And let's just give somebody a PSA of 20 without a percent free. Much higher risk. Almost half the patients are going to have prostate cancer. Now I'll show you why this percent free can make a big difference. I'm going to take this down to, again, kind of that 4.5 number. Let's calculate our risk. At 4.5, if we add in a percent free of 26, look how much we dropped that risk. So we've eliminated some patients that we might have biopsied before. So again, this is kind of a neat thing. I will include that risk profile. So I hope you found that interesting. I had fun playing with that. Put your numbers in there, talk to your doctor, print it out, bring it with you. You know, a lot of us get our testing and the results are in the portal before we even see our doctor. Now, don't play doctor yourself, though. Make sure that you go and you see your doctor to interpret it. They'll tell you what you really need to, how your risk is, you know, they'll look at your family history and all that. But I like this calculator just to kind of give you an idea of how you can kind of fine tune that blood test. Don't eliminate getting it done. So I hope you all enjoyed. I hope everybody enjoyed watching these episodes for Prostate Cancer Awareness Month. I hope everybody gets out there. If you haven't been tested, you've gotten your test done. And join us next month or join us next week because we'll have more on the Uropatient podcast.